Hello, Nadia.
Hello.
It's been a while since we've done our podcast.
Mhm. A couple
Did
months,
you miss
I
it?
think. I did, but we're getting back into the swing of things now.
Yeah. Well, I think one of my favorite things about this podcast is I get a chance to talk to you. And since during the time that we were not doing the podcast, we were actually right by each other, I think that helped.
Yeah, we didn't need it talking in person instead.
Do you think that you, now that you're in school and you're away from your parents and away from home, that you actually appreciate the time with your parents, whereas before maybe you might have resented or like kind of got annoyed about being around parents all the time? Is that
I'm
something that you feel?
Yeah, definitely, but also because I'm really never home. So in the times that I am home, I appreciate it more because all my family's there. But yeah, what is it? Like, I'm only home, like, with the winter break and then summer and then sometimes Thanksgiving, and I'll be here there's spring break, but I'm not usually there, so, like, in the times that I'm home, I appreciate being around you guys more,
Mm.
maybe more than
I
I did in high school.
Yeah. Well, one of the things that came up while we were together was talking about what your future is. And that's a tough subject. I know that it's a tough subject when you are in your 20s and then like basically from 20s to 30s, that's the question that you have in your mind or the question that people ask people that age, like, what do you want to be when you grow up? Or like not even grow up, like what are you going to be in the next couple years? And one time I was talking to somebody and they asked me, I mean, they often ask me, what do you want to do when you're not around? And I mentioned that you were thinking about going to medical school, and however I answered it, they got the impression that I didn't seem that excited about you going to medical school.
Uh-huh.
Do you get that impression or no?
Um, Not that you're not excited, but I feel like you have, not a lot of I guess we're opinionated people, but, like, you just have some usually more negative opinions about it. Or not about it, just, like, negative things to say, or bringing up, like, the the hard parts of going to medical school instead of, like, the other stuff, which is, like, I appreciate also, but how that meant I didn't think, like, you were not excited about it.
Yeah, let me just set the record straight. I can totally picture you being a physician, 100%. In fact, it's not just like, oh, I would be really proud if you became a doctor or like, oh, that's a really like smart thing to become or whatever. Like, if I think about all the professions in the entire world that I can think of, I feel like that's the one that I would, if I had to pick one, that would be it. I
Yeah.
can totally picture you doing it. But that doesn't matter if you aren't sure that you want to do it. And you say that you're about 90, 95% sure,
Mhm.
but it is so hard to become a physician, hard to get into medical school, hard once you're in there. And then and it's so expensive if you don't get into one of those schools that pay for it. It
Mhm.
feels like a really long journey. And then at the end of that journey, you might end up feeling stuck because you've already spent X number of years becoming it and X number of dollars to become it, and now your whole entire identity has become medical doctor. It's hard to walk away from it. And so I think every time I try to cast doubt is because I really want you to feel like despite anything negative I say, you you still wanna do it.
Right. Yeah.
Okay, so the topic that I wanted to bring up today is not that self-doubt or parental doubt about becoming a medical doctor, but our cultural doubt and, about or cultural lack of trust in Western medicine. And I'm not sure if you're getting it on your social media feed or not, but on my social media feed and in my life, I have people that are questioning the medical care that they're getting, the advice that they're getting from their medical doctor, the frustration that they have with how minimal of a like, how narrow of a scope maybe
Mhm.
their medical doctor has when looking at the problem that they've come in with, and then they come in and people have all these other ideas that they're getting from social media about how to best take care of themselves that they're not getting from their medical doctor, and I'm wondering if you're getting any of that on your feeds.
I'm not getting I mean, I can see that. I mean, not see, I can imagine that people would be feeling a certain way, especially since I feel like the only, like, times that I've come across something like that, it's just because of social media, people being able to or thinking that they're able to, like, self-diagnose themselves with, like, mental health, like, problems because a lot of times on social media, they'll be like, "Oh, if you are experiencing this, and this, like, symptoms, like, you could have anxiety, you could have depression, all that stuff," and so then everyone's like, "Okay, I definitely have this," but not that they were actually medically diagnosed, just, um, self-diagnosed. So, in that way, I've seen it, but not necessarily in the way that you're talking about, unless, like, it was in one of my public health classes.
Okay, so let's just say when I was growing up, if I had a health issue or something I was concerned about, with my body or my how I feel, um, my first person that I would go to would be my medical doctor, and I would assume that that person would be able to give me all the answers. So let me ask you about different aspects about your health and where you would go to get the information.
Okay.
If you wanted to, um, eat more healthy,
Mhm.
who would you ask information where would you get your information?
Like, in what way? Like, as in, I think, like, just in general eat healthy or
Yeah,
as in
you're like, "It's 2025, I wanna eat healthy, I wanna know what's right for me to eat." Where are you gonna go?
hmm. I mean, I think it's different for me, and maybe this I think it's my age and all that, but, like, I'm never home, so I never think to go ask my doctor because I don't have that type of relationship with my doctor, and also, like, Google is free. And so I'm just like I mean, I would look it up probably or go on TikTok, I don't know.
Right.
TikTok
We didn't
makes
have that.
sense.
We didn't have that 2 generation a generation
Oh,
ago,
yeah, yeah.
"Oh, I'm gonna get the information on Google or TikTok," you
But
know?
also yeah, it would be, like, online or social media.
Okay, what if you really had an issue, right? You had a concern, you were really gaining weight, you were on the side of, like, what would be considered obese, and now you have to lose weight and you wanna eat better.
Mhm.
Where would you wouldn't necessarily just get the information on TikTok. Who would you
Yeah.
go to for that?
I mean, I'd probably go to a doctor if it was, like, an actual it started becoming, like, a health problem instead of, like, just, like, "Oh, I gotta change the way I eat just because like, just, for the savior or whatever." But, yeah, then I would go to a doctor. I don't have a doctor here. I mean, I have health insurance under Northeastern Health Insurance, but I haven't used it, like, for more than getting, like, a TB test, so, I mean, I do have that option, I just never do it.
Okay. Another health problem. Say you're having really difficult issues with anxiety. It's kind of limiting you. Like you're feeling so anxious that sometimes it's hard for you to face, whatever your tasks are in life, like
Mm,
go to class.
yeah.
You know it's a problem. Where are you going to get help for that?
Um, I would probably reach out to get, like, a therapist. Honestly, well, not that this is my situation, but I've been thinking about getting a therapist or inquiring about it 'cause, it was on my 2025 resolutions, which is more like a 2025 to-do list, but um, I don't think I can get it with my doctor at home because I'm pretty sure I have to be in California to do, like, telemed visits. So, in that situation, I'd have to go to, like, the resources at school or find someone that takes my school's health insurance, but I feels too complicated.
And then let's see, another aspect of health. Say you have back pain.
Mm.
Where you That's kind of a hard one. Slash,
Ew.
we have a s you would come to me. You go to a physical therapist. But if you didn't have me, what would you do?
Like, it depends on how bad the back pain is. I don't usually want to go to the doctor. So, I wouldn't that wouldn't necessarily be my first, like, option or first, choice.
Mhm. And then last one, you have, mm, headaches.
Mm.
Where do you go for that?
I mean, I'd probably ask you guys. Depends on how bad, like, the headaches are. If I thought it was actually something wrong with me, I'd probably go see a doctor, but instead, I would just take Advil.
Mhm. And my point of asking all of this was to see, like, whether or not there was a difference between the way you view when to reach out to a medical doctor versus the way I grew up. Um,
Yeah.
but I can tell you that in my life, there's, like, all these, people that I interact with that have issues with pains because I'm a
Mhm.
physical therapist, and they might go to their medical doctor about it and be frustrated with the answers that they get. Um, and, um, very, like, very true to the age range that I'm in, people tend to be pretty frustrated with the information that they're getting regarding, how to deal with symptoms of perimenopause. And they're turning to social media or their friends for advice on how to move forward. And so, um, my question to you, and this is different. I feel like this is different from when I was growing up, where we didn't have this information at hand, just kind of being fed to us on
Mhm.
on our social media feeds, and so we would tend to just go to the trusted medical doctor who knows us,
Right,
and
yeah.
then ask for information, and then we may or may not question it. But now I feel like that people are questioning because sometimes the information that they're getting on their social media feed is different from the information that they're getting from their primary care physician. And so
Mhm.
I'm wondering, as you go into the medical field and become a medical doctor, um, do you think that this is something that's going to be challenging for you?
Well, I feel like I mean, obviously, yes, how, like, trust is a very important thing in healthcare. Um, I mean, that's, like, one of the things I think about with my experience with doctors in the past, especially with gymnastics. I guess I wouldn't say I really not that I didn't trust them, I always avoided going because I knew they were gonna tell me something that I didn't want to hear. And so in that sense, I feel that and would want to become a doctor that, like, doesn't, like, put their patient like, doesn't, like, I don't know, can meet patients halfway kind of thing. But, I mean, obviously only when, uh, when it's possible. But I don't know. I guess it's something I have to think about. But obviously, I like social media and all that's never gonna go away. So it's gonna be something that I have to, you know, take up like into consideration.
Mhm.
It's a fact. I mean,
I mean, with you might have to be on social media so that you don't get blindsided by people's questions. Like, "Oh, I get it. I know why she's asking me about Ozempic," or, "I know why she's asking me about" I don't know, um, taking, estrogen or using estrogen cream for her face. It's totally what people are being fed on their social media. So let me address why I don't necessarily think this is a good idea.
yeah. I mean, like we can see that now with like Ozempic and all that. I mean, I'm sure if you asked a doctor who sees like women between like 20 and 50, like they would be able to tell you like a large increase in, I guess not just women, but everyone, large increase in um like discussions about getting on that type of medication because of social media. So they probably have had to like adjust how what they say about it, especially since it's supposed to be used for diabetes. So like get better educated on use for weight loss and stuff.
Mhm. Right. Like, it kind of can alert you to think about, like, what are some things that you should read up on and to have an opinion of instead of, like, being told something from your patient, and then all of a sudden you're, like, caught, like, not aware of this topic, and then you feel like you don't have any information to share, and then you could go a couple ways with that. Like, you could get defensive, or you could say, "Oh, well, that's not what" you could just shut people off, or you could say, like, I haven't done a lot of work in this area, so
Mhm.
let me look into it, let me ask my colleagues, and I'll come back to you. But I feel like that's a great approach,
Yeah.
but sometimes people don't feel like, they feel like they go to their doctor and think like, "Oh, they should know everything."
Yeah. I mean, we all kind of feel that way a little bit, but I don't really know. I can't really do anything to fix that. You
Mhm.
should know everything.
Yeah, you should definitely know the red flags and how to keep your patient safe, but I do think that there's something to be said about having the courage and humility to say, "You know,
Don't know.
yeah, I don't know. Let me go find out some information for you."
Yeah. That's probably like what some of the like better providers do.
Mhm. I had a provider do that with me recently. Like, "Oh, that's so interesting that you got that information. I've never seen that before. So glad that you're up, like, you're taking care of your health. Let me think about this and get back to you."
Mhm. Yeah. So,
Um, so one last question, in our last couple minutes, and it is, insurance. Ever since the murder of the United Healthcare CEO, there's been a lot on my feed about, the weaknesses of medical insurance and people getting denied care. I don't know if there's any like, do you have any thoughts on this at all?
I mean, that's like what we talk about in my well, I'm currently taking a health policy class. I just started it, so I have nothing to say about that, but that's what we talked about in my American healthcare class. And um yeah, I mean, I don't know. We talk insurance is a hard like topic for me to grasp sometimes, just like money in general, like, and finance and stuff like that, I feel I have a hard time understanding. But there are definitely lots of things to be said about American healthcare system and how we don't have universal, um, healthcare insurance for everybody, so in that sense, that's how it's been approached in my public health classes, but I think the stuff about the United Healthcare CEO after he was, like, murdered, that was on my feed, but not I mean, people weren't being, like, that analytical about it.
Mhm. I would say, I don't know if there's a way around it, but no matter what, we're in a situation where you really have to take care of yourself and be an advocate for yourself. So, a lot of frustrations are associated with people not getting the care that they want. And it's really frustrating when the experts or the people in charge don't just give you the right care for you. But um, we also have to be responsible too for taking care of ourselves and advocating for ourselves, and some
Mhm.
people don't feel like they can do that because they don't have the vocabulary,
Yeah,
because they don't have the awareness, and so maybe that's part of what should happen is that people should like, the general public or high school students
yeah,
should be educated on how to better advocate for themselves and understand the symptoms and signs in your body that indicate that you need more help, you know?
right. That's like I mean, that's public health in general. I feel like that's what they're working towards. Um, yeah, and health literacy is a very big thing that, like, could help, like, change a lot of people's lives, like, in, um in terms of getting, like, the best care that they can. I know in my communication skills for healthcare professionals class, we did, like, a project at the end of the year on research advocacy and also on, like, health campaigns, and, I really like, the CDC has a lot of health campaigns that they do for things like anti-smoking and or, maternal health awareness, all that, and so, like, their whole thing, is about, like, doing just that, like, showing, um educating people on, like, signs and symptoms for, like, important, like, um, healthcare issues, like triple health stuff, uh, but yeah.
And then there's the issue that people just don't trust the people that are in charge of educating the public about health, you know?
I mean, yeah, it's definitely gonna change with, like, the new presidency, especially with, like, the people that or the person that Donald Trump wants to put in as, the head of, like, the Health and Human Services Department. So, yeah, we'll see.
All right. Well, it was nice chatting again. See you next week.
See you.